Happy National Rural Health Day week, everyone. I'm Kim Norden from the National Rural Health Resource Center. On behalf of the Minnesota Rural Health Conference hosts, the National Rural Health Resource Center, Minnesota Rural Health Association, and the Minnesota Department of Health Office of Rural Health and Primary Care, we thank you for tuning into our very special podcast series, with the first podcast to be released tomorrow, Tuesday, November 17th. COVID-19 has changed how we meet, learn, and exchange information. As the pandemic spread, the Minnesota Rural Health Conference hosts reluctantly made the decision to cancel our annual conference. Our theme for 2020, Charting the Course for Change, was an appropriate reminder that we all need to explore virtual ways of meeting and exchanging information. The annual National Rural Health Day celebration, which is this Thursday, November 19th, is a perfect opportunity to share information with you all. We develop these podcasts for you to cover important and timely rural health issues and discuss how the pandemic has affected us in Minnesota. We also want you to be the first to hear this very exciting news. The show will go on in 2021. We have just made the decision to move forward with planning our 2021 Minnesota Rural Health Conference. It will be brought to you 100% virtually, and it will be 100% excellent. A way to recharge our constant pursuit of a sustainable and thriving rural health system in Minnesota. We will be sending out details in the next couple months, and will post updates on our website at minnesotaruralhealthconference.org. Now, back to our podcast series. Tomorrow, you will hear from the Commissioner, Jan Malcolm.
And of course, we know from a public health perspective that there's so many things that influence health. It isn't just access to health care, as important as that is. It's so many other things about whether people have access to opportunities and whether they have access to healthy choices and the supports that help them to live their healthiest possible lives. And all these issues really are connected. And I think we'll probably be touching on some of them here in this conversation.
Learn how Minnesota Department of Health is addressing the pandemic and its impact on rural Minnesota. On Wednesday, November 18th, hear from Dr. Nicholas Leonards, medical specialist at Minnesota Department of Health's Division of Infectious Disease Epidemiology.
You look at hospitalizations, per 100,000 people, 64 in the white population. It's 547 for Blacks. It's 339 for American Indians, and it's 541 for Hispanic. It's compared to 64. These numbers are astronomically higher.
Dr. Leonards will give us the most recent data on cases, tests, race-related disparities, and tips for how to stay safe this winter, as well as advice for our rural hospitals and healthcare workers. On Thursday, November 19th, we will hear from Terry Fritzma, Senior Research Analyst for the Minnesota Department of Health, Office of Rural Health and Primary Care.
The pandemic has really underscored the critical role of public health in healthcare. These just can't be uncoupled. So I think systems, payments, incentives, all have to be responsive to that. We really need to work to cultivate a culture of support for our healthcare providers and to cultivate workplace resilience.
Mm-hmm. Terry will share findings from the most recent healthcare workforce survey, which included responses from 33,000 providers and had a specific focus on how the pandemic has affected the Minnesota healthcare workforce. And finally, we want to send our deep gratitude to all of you, our rural healthcare workers, our educators, our Minnesota Department of Health staff, our community leaders and activists, and the many rural communities across Minnesota. We are confident that together, we will get through this pandemic with many lessons learned to strengthen our rural communities and healthcare system. We are all charting a course for change right now, and the Minnesota Rural Health Conference is committed to bringing you the information and education you need to highlight best practices across Minnesota and pave the way for innovation. We hope that you're celebrating the power of rural in your community. Happy Rural Health Day, everyone.